Hello and welcome to the presentation. My name is Beena Mathai. I'm a graduate student for the University of Texas, Arlington College of Nursing. This presentation is a partial fulfillment of N5309 teaching and learning strategies. And welcome telemetry nurses. Algorithms. It is a step-by-step procedure. It breaks complex process to simple step. The content is broken down into yes or no steps. ACLS protocol, heparin protocol are examples of algorithms. By end of this presentation, telemetry nurses will be able to recognize signs and symptoms of chest pain, compare STEMI with non-STEMI EKG changes, identify treatment options for STEMI and non-STEMI patients. And now let's talk about chest pain protocol. When the patient complains of chest pain, what are the signs and symptoms we look for? Whether the chest pain radiates to the jaw, arm, shoulder, shortness of breath, nausea, vomiting, and EKG changes. So after the patient says, okay, I have all the signs and symptoms, the first thing you have to do the vital signs. After checking the oxygenation, if the oxygenation is less than 94, your goal is always to keep above 94. Always provide supplemental oxygen. Aspirin, 160 to 325 milligram. Then you give a nitroglycerin sublingual or spray. If the patient complains severe pain, then you give morphine. What are the blood works basically you do? What are the blood works you guys do?
We do troponin, what?
CKB.
Mm-hmm.
And sometimes we also run CBC
Okay.
in case
In case.
something is needed.
Okay. So basically what we, for chest pain, we do blood work, and that's troponin. Basically we run a troponin, okay? And then after this one, we immediately call RRT nurse. And then RRT nurse come take over, and we don't know what, most of the nurses, telemetry nurses, don't know after RRT nurse comes what we do for the patient. This is what an RRT nurse do after she take over the patient. She does a 12-lead EKG. In the 12-lead EKG, what are the things you see? Whether it's a non-STEMI or a STEMI. These are the things we identify first. What is STEMI? STEMI is ST elevation MI. Non-STEMI is non-ST elevated MI. In the STEMI, what you look for is ST elevation or a new left bundle branch block. In the non-STEMI, you look for ST depression and a T-wave inversion. If you look at STEMI EKG changes, you can see the ST. What do you see in STEMI? The ST segment is elevator. And we can basically see in V2 and V3, it's elevator. And in the non-STEMI, you see a T-wave inversion, ST depression, or a T-wave inversion. That's what you see in non-STEMI. And this clearly shows what is the ST segment. See, if you see a big hump, that's the ST segment elevation. And then this shows the T-wave inversion right here. So these are the two main characters you look in the EKG. Whether the ST segment is elevated or a T-wave is inverted or ST segment is depressed. And then you look for a new left bundle branch block. So these are the main things we look in a 12-lead EKG. I'm going to give this so you can see and identify the ST segment elevation, T-wave inversion.
Yeah, it's right there.
T-wave inversion.
Elevation.
It's good that we can see this one as an example now.
Thank you. So after we identify whether it's a STEMI or a non-STEMI, The next thing you have to look is whether the onset of symptoms is less than 12 hours or greater than 12 hours. If it is less than 12 hours, what do you have to do? If it's less than 12 hours, you need to begin reperfusion protocol. What is the reperfusion protocol? PCI. What is PCI?
Is percutaneous coronary intervention.
So percutaneous coronary intervention. So that's basically we call balloon angioplasty. If it's a STEMI, that's the treatment option. After the STEMI, you look whether it's less than 12 hours. Then you start doing this. Okay, so this patient will either go for PCI, or if the patient, if there is no contraindication, we can also do fibrinolytics. What is the fibrinolytics? Any example?
Like a TPA.
TPA, streptokinase, are the examples of fibrinolytics. If it's in our non-STEMI, if it's the onset of, if it's less than 12 hours, you don't do nothing, you just monitor the patient. What are the things you monitor? Any idea what are the things we monitor? We see the troponins are elevated. Because we do the first set of cardiac enzyme, but you do two more sets of cardiac enzymes. So you check whether the troponins are elevated. You look for signs and symptoms of heart failure. You see whether any life-threatening tachyarrhythmias are there. You see whether the patient's hemodynamics are stable. So these are the things you watch before you discharge the patient. So after everything, you have to initiate an adjunctive therapies. Basically, you start the patient on a heparin, you do a beta blockers, and usually doctors send the patients with ACE inhibitors. These are the things they do after these procedures. The most important thing when you have to look for a reperfusion therapy is the door to the needle time. For door to the needle time for the fibrinolytics should be less than 30 minutes. The door to PCI will be less than 90 minutes. So these are the things we have to be very careful, and that's how the doctor chooses whether we can go for fibrinolytics or we can go for the PCI. So this is a basic thing the doctor identifies. Okay, let's take this patient for PCI, or let's do TPA on this patient. So this is basically about chest pain protocol. I can go over one more time. When the patient complains of chest pain, you watch for the signs and symptoms. The signs and symptoms will be the radiating pain to the jaw, arm, shoulder, shortness of breath, nausea, vomiting, and EKG changes. And then you do vital signs. You give supplemental oxygen. You do aspirin. You do nitro. You do morphine if it's severe pain. We call this as mono. And then the blood work we do is cardiac enzymes. Then you do a 12-lead EKG. In the 12-lead, the two important things you need to look, whether it's a STEMI or a non-STEMI. STEMI, you look for ST elevation or a new left bundle branch block. If it's a non-STEMI, you look for ST depression and a T-wave inversion. Then you need to look for whether the onset of symptoms is less than 12 hours. If it is less than 12 hours, you can start your reperfusion therapy. The reperfusion therapy is PCI or fibrinolytics. And if it's not less than 12 hours, then you monitor the patient. Basically, you monitor the patients for troponin elevation, heart failure signs and symptoms, tachyarrhythmias, and all these things you watch. And then you initiate adjunctive therapies like heparin, beta blockers, and ACE inhibitors. The main thing regarding reperfusion therapy is the door to the needle time. Fibrinolytics 30 minutes, less than 30 minutes, and time for PCI is less than 90 minutes. You guys have any questions? Okay, and thank you so much. I really appreciate it.
Thank you.